So that's the question, Dr. Alan Lipman. What would make her
Right.
go outside of the relationship and warn the university?
That's a good question. And this involves switching from the perspective of a doctor to, I'm also a lawyer, and there's a legal question that you're asking, as you may know. There's a very famous case that's called the Tarasov case. And to make a long story short, what it says is that if your patient is a danger to themselves, you know that they're going to hurt themselves, or you know that they're a danger to others, what's called gravely disabled, you have a duty, you have a legal duty to warn the authorities that this person is a threat. And apparently, Fenton viewed, and quite seriously viewed, Holmes as a threat. Now, what concerns me here, Megyn, is that the fact that he was beginning to drop out of school did not end that treatment relationship. That person has a duty to continue to treat that person or to arrange for treatment outside of that treatment relationship with someone else, which, as far as we know, there's a gag order, as far as we know, they did not do. So if there was a deterioration so great that there is a Tarasov warning, that is, this person is gravely disabled, they are a danger to themselves or others, such that we have to warn the authorities to take action to prevent some kind of harm from happening. This person should have been followed, not let go. Mm-hmm. Now, there's information we still need to find out, but at this point I would describe myself as quite concerned about what kind of follow-up occurred with this named and clearly dangerous individual.
Only have a few seconds left, but I want to ask you about, he reportedly watched this movie trailer for this Batman, spin-off.
Yep.
Over 100 times. They said that he was obsessed with this trailer and with the violence therein. That, too, would have been a telltale sign.
Well, of course, it would have been a sign. And while we want to treat that with the appropriate amount of caution until it's verified, if we assume hypothetically that it's true, it would certainly go right along with what we knew about him. That he was obsessed with violence, obsessed with weapons, becoming increasingly delusional, and this was playing into, feeding, and driving his delusions of violence.
The picture's coming together. Dr. Alan Lipman, thank you so much, sir.
Good talking to you, Megyn.